podcast number 4, Health and Healthcare. In recognition of the importance of connecting individuals with care, the Crawford County Memorial Hospital in Denison, Iowa, established a health coach position to work with diabetes patients. And to further improve access and quality care, the hospital established a relationship with an Omaha-based endocrinologist to better serve diabetes patients via weekly telemedicine hours and monthly service in person.
The original intent of the clinical health coach program here at Crawford County Memorial Hospital was to improve the diabetes management practices, particularly with the Hispanic population here. Our program has evolved over time to include the elderly, which was another population that we found needed management services, particularly for diabetes. And now it just includes everybody who has diabetes. We have over 940 patients on our diabetes registry. We use our registry to track appointments, lab values. We can track outcomes through our registry and also identify those patients who are due or overdue for care, both follow-up visits with their providers and diabetes labs. I was very surprised and continue to be very surprised about how many patients that have had diabetes for years that really don't know much about their disease and how to manage it. It's important to understand why you're doing those blood sugar checks. Those numbers need to mean something to you, not just to write them in a book and hand them to your doctor, but what are your goals and are you meeting those goals? Another great resource available here in Iowa that we've been able to use is the Iowa Prescription Drug Corporation. Now I believe it's called SafeNet RX, their drug donation repository. We continue to help more and more patients using this service, which provides no-cost medications to patients in need. We have been able to offer endocrinology here in Denison for about the last year and a half by offering through telehealth. Dr. Island is an endocrinologist from the University of Nebraska Medical Center. There are endocrinologists in Omaha, and there are endocrinologists in Des Moines and Sioux City, but none closer. And as you know, a huge part of our diabetic population are elderly. So to offer that service here in Denison has been amazing. We have 3 transportation vans that offer free transportation to and from appointments here at CCMH. To meet the needs of our large and growing Latino population here in Crawford County, we do have 24/7 interpretation services here at the clinic and hospital.
Well, when I first came to see Sarah, my A1C was at 12. Normal is 7 or under. And I worked on it, dieted, watched everything I ate, wrote down everything I put in my mouth, watched my carbs, and to this day, my last test, I was down to 7.1. I think I probably wouldn't be as bad as I became if I'd had this service sooner. If anyone comes to CCMH and has a chance to get in the program with Sarah, please do so, because she's going to help you.
That our population here is about 47% Latino, and the Latino population suffers more than a Caucasian population does from diabetes and related illnesses. We created the health coach position to work specifically with people who have diabetes as a chronic illness, and to be able to devise a service that would allow them to do the best job possible, not just to manage their medications, but to manage their diet, to get the right amount of exercise, and then also to have access to mental health services, because we know that people with chronic illnesses are folks that need a little bit more assistance when it comes to mental health services. We think it was a really good investment on behalf of the hospital for the community, not just to help people manage their disease, but to help them to live the kind of life that they would like to, be able to enjoy their family and friends, not have to worry about hospitalizations, not worry about the additional costs that go along with that. We are doing more than we had originally anticipated, but we also realize that there's a lot more to be done in the community. So the closer we can get those services, I think the better we can deliver that, and then they can be more healthy. So that's our eventual goal, is to add some additional health coaches, but in specific areas that we know will help people within our own community.
We provide behavioral and mental health services through Crawford County Memorial Hospital, and on occasions we have the opportunity to work closely with Sarah, who either makes referrals to us or we to her. Oftentimes, for example, if she makes a referral to us, it's a person who is suffering from diabetes that has a difficulty maintaining their program due to things like depression or anxiety. We work on that end to help them overcome those barriers to adhering to a program for their health. So it's a nice complement. One of the benefits of having Sarah's services in an environment where we have medical and mental health services is that it provides for the total care of the person.
You know, when we look at healthcare, especially in a rural health setting, there's a lot of different things that influence healthcare. You know, income and stress management and you know, access to healthcare and access to fresh produce, access to all these different kinds of things that Sarah Gall has been able to reach out to the community, and she's really been able to be a great add-on to our practice because we've been able to really provide holistic health care to people, not just address medical problems, but really address their lifestyles.
Adding a health coach has been huge. The impact that it has had on individual patients as well as on my practice has been amazing. Just for the simple fact that oftentimes I would have patients that would either not come in as timely as I would like, or maybe not be as motivated to check their blood sugars as often as I would like. Having somebody that is able to kind of be the point person to take that on.
I'm Leslie Island. I'm a University of Nebraska endocrinologist, and this is Andrea Hoagie over here. She's our nurse case manager for all of our telemedicine clinics. And we started this program about 3 years ago and now go to 5 different locations in rural Nebraska and Iowa. And it's a way to provide patients access to care that they otherwise wouldn't be able to get without driving long distances. And so far, we've seen a lot of great outcomes that have been really happy with the quality of care we've been able to deliver. And it does take some getting used to, and it probably takes a little bit longer to forge a relationship with the patient compared to a face-to-face visit, but I think it works quite well.